Good morning. My name is Andrew Redman. I'm the director of the Mexico Institute at the Wilson Center, and it is my pleasure to welcome you to this morning's conversation, The Awakening of Rare Disease in Latin America. For those of you who aren't familiar with the Wilson Center was created in 1968 by the US Congress through research and events such as this one, to bring together people from diverse geographies, backgrounds, perspectives, to address difficult public policy questions. And there's no doubt that how to address rare disease, how to diagnose and treat, and how doing so intersects with the policy issues surrounding access to healthcare certainly qualifies as a difficult policy issue that is worthy of discussion and debate. And so it is with that in mind that we have convened this event. We're delighted to have partnered with America's Health Foundation, with also the support from Horizon Therapeutics. We're also joined virtually here today by several Wilson Center programs, the Latin America program, the Maternal Health Initiative, the Brazil Institute, and the Science and Technology Innovation Program. All of us at the Wilson Center and our distinct programs are focused on that overarching idea of bringing people together to discuss and hopefully solve difficult policy issues. As I said, we're delighted to have partnered with America's Health Foundation, and it's my pleasure now to introduce the president of AHF, Dick Salvatierra. Dick, over to you. Good morning.
Good morning. Thank you, Andrew, and it's a pleasure to be with you. And I want to thank the Wilson Center and the Mexico Institute for putting this event on with us. The America's Health Foundation is an international public health policy foundation working primarily in Latin America. Our mission is changing policy to save lives, and our focus is always on trying to help policy challenges facing policymakers and bringing policy to bear to both key opinion leaders. The Awakening for Rare Diseases in Latin America is part of a broader effort we're carrying out throughout the region, supported by Chan Zuckerberg Initiative, and in this case, this particular event by, as Andrew pointed out, Horizon Pharmaceuticals. One of the things that gives me a great deal of pleasure is knowing that the panel member of experts that we have are some of the most distinguished throughout the region, and we have been very proud that we've been able to work with them before. So I'm going to turn it over to our medical director, Dr. Mariana Rico, and prior to passing it on to her to introduce our panel, I want to thank Mariana for being a really tough initiative, because she's going to be working, just having broken her nose recently, and is going to sort of carry on. So Mariana, pass it on to you.
Thank you, Dick. Thank you. So yes, I am Mariana Rico. I'm a physician based in Bogota, Colombia. Have been dedicated to public health for the better part of my career. I'm the medical director for AHF, and I'm going to be moderating today's session. So first of all, thank you to the Wilson Center for creating this space with us, and to our wonderful panel, who I am now going to introduce. So first of all, we have Dr. Claudia Gonzaga Jauregui. She's a Mexican expert in genomic sciences and holds a PhD in molecular and human genetics from Baylor College of Medicine, where she contributed to a large population genomic studies such as HapMap3, and pioneered the analysis of genomic sequencing data for the identification of disease genes and molecular diagnosis. Her research, conducted primarily at the International Laboratory for Human Genome Research at the Universidad Autónoma de México, focuses on human pathogenic and polymorphic genomic variations that contribute to human traits and diseases. So thank you, Dr. Gonzaga, for joining us today. Dr. Roberto Giuliani is our next panelist. He is a medical geneticist who founded and is an active member of the medical genetics service of the Hospital de Clínicas de Porto Alegre, Brazil. He is a full professor of genetics at the Federal University of Rio Grande do Sul, is also the co-founder of the Genetics for All Institute and of Casa de Raros, serves as the head of rare diseases at DASA, and is the editor-in-chief of the Journal of Inborn Errors of the Metabolism and Screening. Professor Giuliani's main interests are concentrated in screening, diagnosis, and treatment of genetic diseases, particularly of lysosomal storage disorders, having supervised the training of over 100 doctors and PhDs, and being an author of more than 500 scientific papers. Next, we have Dr. Ivan Gonzalez. Dr. Ivan Gonzalez is a medical doctor and health leader in Colombia. He recently worked as the Vice Minister of Public Health and Acting Minister of Health in the preparation phase of the COVID-19 pandemic. He is currently a consultant at Gresa, a health consulting firm that creates health for development. Further, he has worked in different management positions in companies of the Colombian health sector and abroad, including hospitals, insurers, and NGOs. He has also been a postgraduate professor and member of multiple boards of directors. Next, we have Diego Gil. Diego is the executive director of the Federación Colombiana de Enfermedades Raras, FECOER, which is an umbrella organization bringing together 44 patient groups to represent the voice of the rare disease community in Colombia and advocate for better inclusion, care, and treatment within society. Since taking up his role in 2020, Diego has led FECOER to work with national and local policymakers to improve the coverage of care for persons living with rare diseases in Colombia. Additionally, he serves as a technical advisor to the Colombian Network for Access to Biotech Medications and is a member of Rare Diseases International panel of experts working to build a pilot for a global clinical network for rare diseases. And last but not least, we have Antoine Daher. Antoine is a Brazilian businessman who has dedicated his life to the cause of rare diseases since his son was diagnosed with Hunter syndrome in 2012. He founded Casa Hunter to help Brazilians living with rare diseases and uses his strong presence in Congress to advocate for laws and policies that ensure a better life for people with rare diseases. In 2019, he became the president of the Brazilian Federation of Rare Diseases Associations. He is also a member of the Rare Disease Commission of the Federal Council of Medicine in Brazil and president of Casa de Raros. Okay, so with that, we can get started with our program today. We have Dr. Gonzaga, who is going to give us an introduction and set the stage for the conversation today. So when you're ready, Dr. Gonzaga, the floor is yours.
Thank you, Mariana. I'm going to share my screen. I have a few slides. I hope you can see there. Can you see my screen there?
Yes, we can. Thank you.
Okay, great. So thank you very much for the invitation to this panel. And I would just like to set up the stage a little bit and talk about what we mean when we talk about rare diseases and why are we discussing today the importance of having early diagnosis for these rare diseases. So rare diseases as a whole are is a definition for low prevalence disorders that occur in the general population. That means that they affect a small number of individuals at a time. There are different definitions of rare diseases. So the United States of America has the definition according to the Orphan Drug Act of 1983 of a disorder that affects less than 200,000 Americans at a time. In Europe, the definition is less than 1 in 2,000 people. In our region of Latin America, there's not a consistent definition. Some countries have adopted the European definition, And some other countries don't even have a definition yet. So Mexico, for example, has a definition of a disorder that affects no more than 5 people for each 10,000, which is a very similar calculation to the European definition. So while individually these diseases are rare, and we know that there are, there have been described more than 7,000 rare diseases. As a group, they are very common, affecting somewhere between 6 to 8% of the world population. So an estimated of 300 to 350 million people. And just in our Latin American and Caribbean region, we estimate that about 50 million people live with a rare disease. And in Mexico, for example, 10 million people, of which approximately 2 million are indigenous or underserved individuals. As I mentioned, there are more than 7,000 rare diseases that have been documented. And one thing that's very important to the conversation that we're having today is that 80% of them are genetic. So that means that there are tests and technologies that we can use to diagnose these diseases. 70% of them are congenital or have a childhood onset, and only 5% of these rare diseases have a treatment. So, as I said, given that the majority of them are genetic and we have technologies that we can use to diagnose these diseases, still we have these diagnostic odyssey, which is this very tortuous journey that patients and families go through when when the patient starts developing symptoms, and then they are trying to figure out what the disease is. So just this beautiful infographic that many patient organizations and urologists produce that really portrays really nicely what this diagnostic odyssey is, right? When the first symptoms appear and there's a search trying to find what are these symptoms corresponding to which disease, many visits with specialists, unfortunately many misdiagnoses or no diagnosis, in some cases even wrong treatments, and then referrals to other specialists. And then this long journey, eventually maybe someone has the idea to do genetic testing, and hopefully in some cases that will lead to a diagnosis, but in some other cases additional testing is needed. So ideally, once the correct genetic test is performed, there's a diagnosis, and then the patients can have genetic counseling and find also other organizations, other patients that they can form community with and move forward now into what we are naming the therapeutic odyssey, right? So this is the journey that we have described as diagnostic odyssey. And in countries where the implementation of molecular diagnostics has been done, so mostly higher income countries, the US, Canada, Europe, the UK. So the time to diagnosis from initial symptoms, it's on average 5 years. However, for example, in Latin America, our average time to diagnosis is 10 years because we still don't have applied as we should these technologies to have early diagnosis. So in the last decade, 12 years or so, since we started implementing genomic sequencing, especially in the field of rare diseases, this has revolutionized how we are able to diagnose early, accurately, rapidly rare diseases. And you can see here the increase in the number of new genes that have been reported since 2010, when we started applying genomics for studying and diagnosing rare diseases. So why is it important to have this early diagnosis? So this is important to achieve early interventions that can avoid adverse outcomes for these patients. These can provide access to effective and in some cases even now personalized therapies that are designed to address the specific molecular defects in these disorders. Again, this provides opportunities for planning based on what we know about the disease, what the disease prognosis is, and the natural history. It provides answers to patients and families and opportunities for genetic counseling, for planning for other pregnancies, for cascade testing, etc. And ultimately, what we are going to discuss here is also for development and implementation of public health policies that can really provide support to patients living with rare diseases, and ultimately the implementation of precision medicine. So in general, we are talking about a need for a program and a concerted efforts where we can achieve diagnosis, increase research, increase education and training for professionals, and diagnosis for patients, and research in rare diseases across Latin America. And that's what I'm hoping that we can discuss further today. So with that, I can answer questions or continue with the conversation. Thank you.
Sure, thank you. Thank you, Dr. Gonzaga. And we'll have our question and answers session a little bit further on. So if anyone from the audience has any questions for Dr. Gonzaga or any of the other panelists, you can get them to us through social media, through the Wilson Center social media. And thank you for that great overview. And definitely something that we want to highlight is that even though individually rare diseases affect a small number of people, as a whole, they affect a substantial portion of the population. So they really do require our attention. So I want to continue on with Diego Gil from PECOER. Diego, you have dedicated much of your life to advocating for better policies for rare diseases in Colombia and throughout Latin America. Can you share with us what steps Colombia has taken to combat health inequities for people living with rare diseases? And then we would also like to know how the COVID-19 pandemic impacted people living with rare diseases in Colombia, and the ongoing efforts to improve care.
Gracias, Mariana.
Thank you, Mariana. Can you hear me well? Perfect. Definitely, Latin American patients have seen a substantial improvement in their situation. However, we still face challenges to implementation. Fortunately, some countries in the region have a legal framework for these diseases. In Colombia, we have a solid legal framework in this sense. However, we need to work towards the better implementation of those laws. And patients should see themselves reflected in the journey. We need effective social inclusion. There are some challenges at this level still. And here, the challenges are not only related to access to the services, but to very basic services such as access to fresh water, access to public institutions, access to clothing, housing, etc. These aspects are essential because this doesn't only affect patients with rare diseases, but their caregivers and their families as well. This also helps us address the discrimination that affects these patients. Some countries have created patient registers as well as assistance centers to provide a holistic assistance and avoid the journey being more and more detrimental to that person's life. We have worked with different Latin American organizations to join efforts and to close the gaps between one country and another. when the UN resolution on rare diseases was adopted last year, action plans have or had to be implemented in each country. Health services should therefore provide access to all the services necessary to ensure the inclusion of this population. As you said, Mariana, the pandemic was very difficult for different populations, including the patients with the rare diseases. And we saw medical services become slower. Many patients had to isolate themselves because they faced an increased risk of catching COVID. And this was for the patients that were already diagnosed. Remember that the prognosis of rare diseases is very slow. It can take many years, up to 25 years in certain extreme cases. And of course, these times were increased due to the pandemic. Access and follow-up of the different treatment was also affected by the pandemic. So this is something that affects the already diagnosed cases. Some populations don't have access to basic services, and the challenges related to access to healthcare were even worse. And this was not only a matter of access to treatment, but also the access to the or rather economic aspects. For example, many families lost their jobs, and many people could not continue their treatment due to all the problems they faced as a result of the pandemic. That is why this was definitely a very complex challenge for our population.
And how even in a country like Colombia that already has a strong legislative framework, we still have a lot of work to be done to translate and implement that policy into action. And also thank you for highlighting the importance of the UN resolution that was passed last year as a call to action for states to address rare diseases through policy. So I think, Dr. Gonzalez, I think this is a good time to continue with Colombia's situation here. As we have mentioned, Colombia is one of the countries with some of the most advanced rare disease policy in the region. So we would like to share with us first, through your experience at the Ministry of Health, what was Colombia's driving force to develop and implement rare disease policies? And what were some of the challenges that decision and policymakers face and continue to face now in the implementation?
Morning, Mariana. Good morning to all our colleagues from different parts of the region. Thank you so much, Dr. Gonzaga and Diego for preceding me. It's really a pleasure to be here. So, as Diego was saying, I think we have a strong regulatory framework given not only by two specific laws that are one of 2010 and one of 2019 about screening, but other laws that try to support these specific aspects of rare diseases. But as so many things in our countries, the problems is not what it's written, but what happens in reality after things are written. And the truth is we have a lot of gaps between what it's intended in the law and what it's happening for people with rare diseases and their families. First, I would like to address the aspects between or the ethical issues between between equity and equality. I think that's one of the most hard issues to face when you are making public policies. And unfortunately, I think for the future, it's one of the aspects that creates a very, very complex mood or environment to discuss about public policies in rare diseases. So you have the classic ethical issue around giving one child $1 million in a treatment versus intervening in 1 million kids with $1 per capita. So I think that's one of the aspects it's important to face, but sometimes activism and sometimes all the sensibility around these topics make conversations very hard to develop. So that would be my first point. Sometimes conversations are really hard. Second, I think there's a lot of gaps in terms of information and lack of knowledge, not only of the citizens, but also in the health services. So the classic story of people with rare diseases are multiple visits to doctors and hospitals without any diagnosis. And after 2, 3, 4, 5, 7 years, you are diagnosed after suffering a lot and having been given a lot of roundabouts in different health services. So I think part of the importance, and I want to link this to the conversations, is to start to create a new narrative about rare diseases. The only name, the definitions, always put this in people that are only interested. And I'm sorry if I say that, but I think we need to change the narrative in order to involve all the population. Because when we talk with parents with children with rare diseases or families that have been facing this, they feel extremely lonely. As lonely as you feel in a ministry when you have to create regulation about rare diseases, because it's rare, the name, the definition. So we need to change the way how we address these topics in order to have it available and create an environment that promotes conversations. Third, I think there's something that it's very important to mention. It's not easy to do it also, but are the conflicts of interests between pharmaceuticals and patients and associations. I think not always you find that, but sometimes you do. And as is a rare thing or a rare disease, and it's so hard to develop and it's so hard to talk about it, this type of conflicts of interests create a lot of distortion around the objectives you want to develop or create. So I'll stop here, Mariana, just to see if there's another question or comment. But I think I would conclude by saying that it's not only about having regulatory frameworks, but most of all, creating the adequate environment in societies in order to approach this hard topic in terms of policy, public policy and resources around ethical issues and quality of life for families and patients. Thank you, Mariana.
Thank you, Dr. Gonzalez. Yes, I think that's a very interesting and important point that you highlight. on the importance of making this everyone's problem. This is not the problem of a select few in our society, but this is something that really affects a large amount of people. And another thing, just to kind of ricochet off of that, is that we may have 50 million patients in Latin America, but rare diseases affect everyone, the family, everyone surrounding the patient. So the actual number of people that we have affected by the disease is much greater. Dr. Gonzalez, if you would, we would like to talk, we would like to ask you to talk to us a bit about how regulatory bodies can approach technologies for rare diseases, including testing and treatment. So what factors, aside from treatment cost, as you were mentioning, should authorities consider when reviewing orphan drugs? Are there any innovative entry or contracting mechanisms that can be used to improve or ensure access to these often high-cost technologies?
Thank you, Mariana. So I think we need to evolve the conversation, as I was saying, to create healthcare models of delivering the services. People or families with patients with rare diseases are approached by countries and by health systems. It's not only about technology. Technology is just one of the components of comprehensive healthcare approach for patients, but I think you need to understand, or we need to understand that as societies, all the different aspects patients needs and family needs in order to address their conditions. So when we were at the ministry, we tried to create a model that started with education, and had the patient and its family at the center of all the components. Because again, it's not only technology, but it's how you are going to move your child from your house to the health medical center. How are you going to create an appropriate educational environment for your child? How are you going to receive some kinds of subsidies? Because you need someone that takes care of the patient or the person. So in countries like Colombia, it's almost impossible to survive if you only have one income in the house. So how are a lot of things going to arrange before you get even to the disease, before you get even to the technology? Then I think you need to create, and that's the very hard part. I don't know how to do it. I'm just going to say it. You need to create conversations around what it's going to be accepted by the society. And that's the hard part, because if you have 10 or 12 children with one rare disease, and you have a new technology for those 10 or 12 children, but each treatment costs $2 or $3 million per year, then you need to understand what you are going to do as a society in those terms. While you don't address this as a society, you are going to have people legitimately fighting for their rights of being served with new technologies. You're going to find technologies that maybe are just arising in the effectiveness you need or in the benefit you need for patients, but still they are a hope, and you'll never find a way to understand or make someone understand why your child that has this disease is not going to be exposed to a new technology that maybe it's going to help him. So I think those are the types of conversation that we need to develop, because again, between the different varieties of what we know today about rare diseases. Some of them are very known, some of them have treatments that have been proven, and others are still new, others are unknown, and technology doesn't function the same for all of them. So finally, I would say that part of the situation that this conversation should address is a fund in order to promote and develop treatments that have not been proved, but that are important in order to move the agenda in some of the rare diseases. So finally, in my ideal world, you will have a comprehensive model, then you will have some things that are completely covered by the health systems, and then you have a fund in order to research and try new technologies. And once they have been proved, they should go or to the one that it's covered by the health system, or they would be expelled out of the fund if they don't give the results we're hoping for. But I think we shouldn't leave anyone behind, no matter the incidence or prevalence of the rare disease. But at the end, we need mechanisms and conversations to make it feasible for societies to approach these situations.
Wonderful. Thank you, Dr. Gonzalez. And it's interesting, the model that you mentioned in terms of achieving the funding that is often necessary for these high-cost treatments, and that obviously pose a challenge to many of the region's health systems. So now we would like to continue with Dr. Giuliani. He will be joining us to share Brazil's experience with rare disease policy. So when you are ready, Dr. Giuliani, the floor is yours.
Thank you. Thank you. To Mexico Institute and Wilson Center for organizing this event. Thank you, Dick and Mariana, for coordinating it. It was a pleasure to hear Claudia, Diego, and Dr. Gonzalez approaching this topic, and I think to paving the way for the discussion. So just try to share my screen. Okay, so I will talk a little bit about legislating on rare disease, and I will give the example in Brazil and approach health expenditure, public policy for rare diseases, drugs for the treatment of rare diseases, regulatory review for clinical research, also in finishing by talking a little bit on newborn screening program. And this, I think, has evolved in the last years due to a combination of efforts involving health authorities, scientists, advocacy groups, and also politicians, and also involving the many sectors of the society who are symbolized on this picture. So let's talk about health expenditure. Brazil has around 9–10% of the GDP dedicated to health, which is not that bad. Is more than the proportion of Mexico, more than proportion of even South Korea, but the problem in Brazil, I think, is the way this is provided to the population. We will see in the next slide. Brazil has, if you take Brazil as a health expenditure as one, it's about 1/3 of what is the OECD average. So it's about 1/3 of the developed countries. It's below Chile, a little bit over Mexico and Colombia, but it's not that bad. But the problem is that I think the major problem is that in Brazil, we have 77% of the population that depends exclusively on the public health insurance, and this percentage has just 46% of the investment. in healthcare. And on the other hand, the 23% that have access to private health insurance, they have about 54% of the health expenditure. So this is one of the problems that we have in Brazil, and I think this is may happen in other Latin American countries. Let's talk just a little bit about how the development of public regulations for rare diseases. So in 2009, we had one of these first attempts to have a national policy for rare disease. There was a resolution by the Ministry of Health, but was never implemented. It was just paperwork. In 2011, we have it was declared the Rare Disease Day, the last day of February. Another law in 2011 stating that what is rare disease? It's no more than 65 people affected among 100,000 people, which means that around 1 in 1,500, no more than one in 1,500 could be a rare disease. In 2012, there was.
Sorry, I'm sorry to interrupt you. Could you click the presentation mode very quickly on your screen so that we can get the full presentation?
It's not on presentation.
No, I think the screen may be frozen.
Oh, I am in the presentation mode.
Sorry, let's just see if we can get this quickly sorted. Okay, there we are seeing your screen.
Now presentation mode. No.
No.
Maybe
No.
maybe if Samantha has a backup with her, she can.
Sam, so do you want to take over the sharing?
Yes, give me 1 second. I'm opening the presentation on the right side.
Perfect.
Okay,
Thank you,
here.
and excuse us for this.
No, sorry. For me, it was appearing as it was working well. Sorry, it was not. Yeah. Okay. You can move on. I don't know where you were able to follow. Until where were you able to follow? Until when?
So which slide would you like us to put on?
Go ahead. I think it was about the 10 slide 10. Yeah.
On what?
Are you?
On slide 10.
There we are.
Yeah. Now. Yeah.
So we're still seeing the opening slide.
Yeah, me too. Yeah. Okay. Yeah. Yeah.
There we go.
Okay.
Thank you.
So in 2012, we had this federal funding for research in rare disease. What's a good move? Then next one in 2013, we have a legislation to improve the approval and purchase of orphan drugs, which was a good move for the patients. Move ahead, please. And it's important to say that no, well, just before. Before that, yeah. In 2000, we had this in 2013 still legislation to have mandate the private health insurance to provide access to, especially to diagnostic tests for patients with suspected rare disease. And the major development, next one, please, was in 2014. Finally, a national policy for rare disease was a resolution by the Ministry of Health. And the next one, please. And then there were created reference center services for rare disease around the country. These red dots are the ones that are already established, in the orange, the ones that are being proposed. So it's Still not a very good coverage. We see the left many parts of Brazil without a center, but at least on the east coast, we see that there are many reference services. Can you move ahead, please? And this started to be designated in 2016, 17. And these centers received from the Ministry of Health fixed amount every month to maintain a multidisciplinary team, and also a payment for every patient that is evaluated, including this clinical assistance, laboratory investigation, and genetic counseling. So let's move ahead. And then in terms of drugs, very quickly, next one. We have, there was an improvement on this process with speeding up the technical review by Anvisa, our drug agents, also the price approval by one of committee of the Ministry of Health, and also the adoption of the new therapy by the public health system. And then there are some, next one, please, the guidelines for use of this new technology in the public health system. So this was evolved. Before it was a long time. Now at least it has improved the timeline for this adoption of these new therapies in the public health system. And there is the Supreme Court in Brazil, the High Court, decided to some rules to provide the drugs that are not in the guidelines, but there is an urgent need to provide to patients. And this includes that the drug should be approved by the drug agents. The patient cannot support the treatment, that is usually the case. And also, of course, a prescription and a justified indication of that use. Next one, please. Regarding regulatory review, this is also improved by new regulations. Next one, please. The National Ethics Committee has some rules to provide fast track for this rare disease. And the same happened, next one, please, at Anvisa. At Anvisa, next one, please. At Anvisa, they also provide a fast track review of clinical trials for rare diseases, and this is in place since 2018. So there is a lot of new regulations that provide a better environment to research and also therapy in terms of rare disease, and also to diagnosis. Next one, please. So there you can move on. This is just to say that there is the process. Regulatory process is quite complicated, but now what have that most of these steps, they go in parallel. So we can have approval of a clinical trial in 5-6 months after it's submitted, which is quite reasonable. Despite all the steps, the process should be approved. This is also something that is quite reasonable. And so I think the last one, about just a word about newborn screening. Newborn screening is next one, please. Is starting in 2001 in Brazil for 4 diseases. 2014, 2 diseases were added, and last year we had expansion of this newborn screening. It will reach around 60 diseases when this expansion is completed, but it is still pending of implementation. This expansion. So far, we have just 6 diseases in national, but it's a good platform. It's a public health platform for the diagnosis of some selected rare conditions. So in the last slide, I think Tony maybe may touch on this point, is we are now building a network of rare disease centers in Brazil. It's a Casa dos Raros, or House of Rares. And this project is moving on. We already have one center almost ready to start in Porto Alegre. Next one, please. And we will start, and then we will start to build new centers around the country. The second one will be in São Paulo, and others will follow in the other Brazilian regions. So thank you very much. Sorry for the technical problems, but I think it was to have kind of the discussion to go further. Thank you.
Thank you very much, Dr. Giuliani, for sharing Brazil's advancements in rare diseases. And it's encouraging, especially to see that Brazil is fostering a favorable environment for clinical trials and research, because we know that this is a very important unmet need for representation of the Latin American population in clinical trials. So if we can now continue with Antoine. You have been at the forefront of advocacy in Brazil for rare diseases. Can you share with us what is the role of patient organizations in advocating for improved public health policies for patients living with rare diseases? And what challenges have you encountered as you advocate for rare diseases before the state? And how can other countries learn from your experience in Brazil?
Hello, Mariana. Hello, everybody. Thank you very much for inviting me to contribute a little bit for this important discussion. I guess the patient associations play an essential role in improving the whole scenario of our country with regard to rare diseases. A good example is the Ordinance 199 of 2014, which established criteria for treating patients with rare diseases and also criteria for approving centers that will be qualified as reference center for rare diseases. Another example was the result of hard work, especially by Febra Harris and Casa Hunter, was the law approved last year to expand the newborn screening from 6 diseases to more than 50 diseases. A work fully supported and carried out in conjunction with patient associations. We can say surely that all the resolution we have today, the various bills in the National Congress, were all the result of pressure, articulation, and partnership between patient association with municipal and state governments and also with the federal government. A major patient association connects the pharmaceutical industry, government, academia. A major patient association connects all stakeholders with the government, the Ministry of Health, and health departments on behalf of patients. And it also makes the difference, bringing experiences from other countries, cutting-edge experiences to implement public policies that bring benefits to the population with public policies of sustainability in the medium and long term.
Sorry about that. Thank you. Thank you, Antoine. And a little bit further, what are some of the just challenges that you have encountered in your advocacy journey in Brazil?
The biggest challenge I found working with the government is to have a medium and long-term planning. I don't know if you know, but in the last 2 years, we had more than 4 new Minister of Health. We have a record in health minister changes. We also have a lot of changes in government secretaries, and the heads of these secretaries are essential in the Ministry of Health. When you work on rare disease, you have to establish programs, not just for the short term, but also for the medium and long term. So sometimes you do a very well done job, but it doesn't continue because of these changes that take you back to square one. This is a very tiring, unfortunately. We find this difficulty here in Brazil, not only at the federal level, but also at state and municipal levels. That's why we set up a long-term plan in the Brazilian executive with determinations and long-term objectives. But this is a difficult task since the team that works today in the government does not continue in the next one.
Of course. Thank you for that. And yeah, you bring up that critical point of the importance of continuity and having a long-term vision, which is fundamental for policy implementation. Is there anything else that you would like to add about your experience in advocating for rare disease policy in Brazil?
No, I guess what our experience, I believe that all countries, associations have learning opportunities, but one fundamental point is to learn to have a professional approach. Indeed, we are patient association, totally philanthropic, but we need to learn to work as a professional organization, very well structured. It's necessary to develop an infrastructure, a solid structure to defend our rights and goals. Another important point is we must raise awareness in the countries, in all these countries, to develop and to do advocacy based in evidence, not only based on the appeal of fathers and mothers of patients. We have to do advocacy, but our advocacy has to be based on evidence, on transparency also, because we link all these stakeholders together with the public, with the Ministry of Health, with the Secretary of Health. We have to do this work without conflict of interest. Our interest is to solve the problem, is to deliver models and projects that bring sustainability to the government and also bring solution to the patient. We need to professionalize our advocacy. That's it.
Thank you, Tony. Yes, I think that's so important what you just mentioned about bringing a sort of elevated state to patient organizations and kind of changing the perception and valuing everything that the knowledge and the value that patient organizations can bring to policy making, and really make that special difference. So thank you to all of our panelists for the very interesting insights that each of one of you had, and for giving us this very comprehensive perspective on rare diseases from each of your expertise. So I think we have a lot of important takeaways from our panelists' interventions. I think what is very clear about the landscape of rare diseases in the region is that we have countries in such varying stages of policy development and awareness and advocacy and access. And this really adds another dimension of complexity to the situation. So we'd like to go into a question and answer session. So we have some questions that have come in from the audience. So I'm going to direct them to each one of you panelists, but please feel free to step in and complement each other's remarks so that we can really get everyone's perspectives. Okay, so we have here one question. And I think we can direct this to Diego from FECOER. What steps has Colombia taken to combat health inequities for patients living with rare diseases?
Bueno, han habido unos avances importantes, por supuesto, el hecho de que exista.
Well, there has been important improvement. First of all, we have Law 1392 from 2010. This is a law on orphan drugs, and it sought to address a specific need in the situation of these patients. Another milestone was the approval of the statutory law of 2015 that establishes that patients with rare diseases should receive a special protection from the Colombian government if they have other vulnerability factors that affect them. We are currently working on the implementation of this statutory regulation. And just as we have promoted the implementation of other laws, so we are working on the early screening of these diseases as well. We are promoting the development of new screening centers because, of course, we cannot provide assistance to our patients if we don't have centers that will help them with screening or that will provide a comprehensive care or that promotes awareness, education, the proper conditions, because otherwise our patients are unprotected. We're also creating on a comprehensive care roadmap. We already have legislation about it, but we are working on the actual implementation. As Antoine said, we are working towards strengthening the participation and the interaction among the different stakeholders, because everybody is relevant for this topic. But we also needed to provide the support to our caretakers because our patients cannot be well off if the caretakers are unable to continue their personal and professional projects. We also have a national patients register with more than 7,000 patients, but we needed to strengthen it to have the detailed profile of each one and contribute to the update of our rare disease list. Currently, we have identified approximately 200 rare diseases in Colombia, so we needed to improve the development of this list so that we can also develop an epidemiological approach to this. Rare diseases also pose challenges in terms of funding for the health for the public health systems. So we needed to ensure that we will have enough funding for this population.
Thank you, Diego. Thank you for that comprehensive answer. We have a question. I think this might be well suited for Dr. Gonzaga. So one of our audience members wants to know, in the US, there are many Latin American immigrants with rare diseases. Are there efforts to share diagnosis between Latin America and the Latin American immigrant population in the US?
Thank you. So not specifically for Latin American or the Hispanic population in the US, but the rare disease community at large, there's definitely a lot of sharing, especially when you have new potentially disease-associated genes. So regardless of the background of the patient, there's definitely this initiative to share new results, to share new variants, and do what we call this matchmaking, sort of putting together the different patients from different parts of the world. One of the things about rare diseases is that given the genetic changes in the patient, so these are very highly penetrant variants that will affect patients from any background. We know that certain diseases, yes, there are variants that are more prevalent in certain populations, but for a lot of rare diseases, they will affect people from any background. So there's this need of a global collaboration of clinicians and researchers in rare diseases, because you might have a patient from Mexico and a patient in Seattle and a patient in India, and so that have variants in the same gene. And just by focusing on your country or your region, you're unlikely to find a second patient. So having this collaboration across the world is really important. But I'm not aware of any specific initiatives of focusing on Latin American immigrants or Hispanic population in the US for this.
Okay, thank you. Thank you, Dr. Gonzaga. Dr. Giuliani, I think this one can go to you. So treatments for rare diseases have unique challenges because of small patient numbers, limited understanding of the pathophysiology of the disease, a lack of established endpoints, among others. In terms of the regulatory process, is it necessary to use different methodologies to evaluate technologies for rare diseases? You're on mute.
Thank you, Mariana. This is a great question. We face different challenges when working with rare disease in terms of the development of new therapies, the small number of patients, the heterogeneity of these patients, the fact that many diseases are progressive and depending on when you are approaching the patient, they may be in a different phase of the disease. And also many of these diseases are quite severe, and this contraindicates the use of, there poses ethical questions to use placebo and to evaluate comparing patients on therapy and patients on placebo, because the patients on placebo may deteriorate very, very quickly. And so this is a problem. So I will have to develop a new approach and to work with a small number of patients and try to make a more homogeneous group. And also, and it's very important, one thing that we haven't read, it's very important to have control groups that may be built outside the study by natural history studies. So it's very important to have these natural history studies of rare disease to help the development of new therapies for these conditions. But I would say that having this information on natural history is very useful, and also innovative ways to work with small samples, and this may include new statistical approaches, and also some ideas like to make the clinical trial using the patient as its own control, and there are some examples of this. So there are a lot of challenges to develop these therapies, and this is something that we should be very, very creative and in terms of to address these challenges and try to develop these new therapies for this due to the high unmet needs of these patients.
Okay. Thank you. And so the regulatory agencies there also need to keep that in mind throughout their process, because of the small clinical trial samples, normal HTA methodologies might not always be suited for these drugs, is what I understand from what your answer, correct?
Exactly. They cannot evaluate this process as they evaluated drugs for diseases that are common, like diabetes, hypertension. It's completely different, and you are right. And I think you have been evolving on this situation. There are some committees in the drug agents that deal with rare disease and now get used with this environment.
Great, thank you. Dr. Gonzalez, I think this question is suited for you. So oncology and rare diseases share some similar issues in terms of access, in that they often require access to high-cost testing and treatments. Are there any policy advancements or innovative mechanisms in place for oncology that we can draw from to improve access to testing and treatment for rare diseases?
Thank you, Mariana. So I think one of the aspects that it's important to understand is how the definitions of rare diseases is approached in different parts of the world. So there are some oncology conditions that are considered rare diseases. And I think that it's important. I was just checking, and I have it here. I don't know it by memory, but I was just checking that, for example, in Japan, a rare disease is the one that is present in less than 50,000 people. In China, it's the one that it's less than 1 in 500,000 people. Argentina is less than 10 per 10,000 people. Colombia has its own definition. Mexico, it's the same as Argentina. Korea and Singapore are less than 20,000 people. Why am I saying this? Because I think that when pharmaceuticals find the appropriate incentives in the market, they are going to pursue for research in order to create or develop new molecules that are going to treat the diseases. But when they are not, they need to have a very specific organizational DNA in order to approach this research. Are very specialized and highly cost bets that some pharmaceuticals do in order to develop treatments. So the difference for me between cancer and rare diseases is about the revenue and income in the long-term cycle that pharmaceuticals perceive from the development and research of some medicines. So if I can round my first idea, I think it would be interesting to create like a forum in order to debate around the different definitions of rare diseases and try to get some homogeneity between different parts of the world with specific characteristics. Second, I think the difference between oncology and rare diseases, if I'm going to be a pragmatical difference, is that oncology is increasing while we are aging and we are switching to a different epidemiologic burden of disease, while rare diseases are not. Rare diseases are going to maintain, and what is happening, if I remember from my days of the ministry, is that we have at least 2,500 rare diseases diagnosed, defined, or maybe 2,800 diseases, but none of them is going to share the conditions of oncology. So, so unfortunately, Mariana, my answer should be no. I don't think there is a similarity between oncology and rare diseases in terms of development for new technologies. But I think if we approach the definition, would be one point of starting a conversation. And finally, I think that, as I said in my last intervention, maybe if you create the appropriate incentives between the public and the private parties to develop and try and research around technologies for rare diseases, you can align all the incentives between patients, families, and funds, because I think there's a profound disbalance between all these aspects. So unfortunately, my answer is no. I don't see any relation for now.
Okay, thank you, Dr. Gonzalez. Okay, Diego, I think this question is can be for you. Colombia has specific and designated routes for healthcare delivery for people living with rare diseases. Can you tell us how this is going to benefit access and care, and what are these specific routes designated for people with rare diseases?
Nosotros acá en el país, digamos que tenemos algunos avances en términos de diseño de ruta, de atención.
In Colombia, we have made the progress in terms of improve the roadmaps, but the roadmaps have been developed by insurance companies. They have developed guidelines to provide a comprehensive care to our patients and to simplify administrative procedures that are often seen as barriers. However, the current challenge that we are discussing as part of the National Forum of Rare Diseases, where several stakeholders come together, is that we need guidelines, because even if we have progress at the level of the insurance companies, we need standard guidelines so that we provide a comprehensive support. For example, we need to improve our primary care, because good primary care is a determining factor for a subsequent prognosis. We also needed to address issues such as psychosocial assistance. So this is a topic that we are continuing to work on, and we hope to make progress in the next year. But there is a stronger commitment from the government. We are going through a transition period, and we hope that the new administration will continue to promote the development of this roadmap, so that the patient journey is a lot more favorable, less dangerous, and that it presents less of an impact for patients and their families.
Okay, I think we have finalized our question and answer. Let me see if there's any other ones. Okay, I think that's it. But one last thought for all of our panelists here with us. Maybe if each of you could, as a closing question, identify one critical policy decision or recommendation that you would implement if you could. So think of just one critical recommendation or policy decision that if it were up to you, you would implement in your country. So if any of you would like to start with that. Sure, go ahead, either of you. Claudia, if you want, go ahead.
Diego, go ahead.
Ok, bueno, creo que es importante el trabajo intersectorial, ¿sí? Si podemos...
I think that cross-sectorial efforts are very important. If we can make regulations, promote the participation from stakeholders of different origins, that would be very important, because in order to provide a better care for our patients, we needed to understand the different needs that our patients have. We need more inclusive education, technologies, digital literacy as well, because to a certain extent, we expect the patients to be highly digitally literate in the short term. So I think that legislation should promote a cross-sectorial effort for the benefit of society.
Well, I think for Mexico, what I would like to see is guaranteed genetic and molecular testing for any patient that is born with a suspected rare disease in the country. Regardless of the healthcare system the parents are affiliated with, or the town or the city they're born. I think guaranteeing, as Colombia is doing, access to genetic testing, to molecular testing for patients with rare diseases is a huge, big first step to moving the access and the opportunities to these patients forward. So that's what I would like to see for Mexico.
Thank you, Dr. Gonzaga. Antoine?
I guess in Brazil, we improved a lot in the regulation scenery. What we have to now to make an advance, it include the patient association in the decision makers' decision and to include also the patient association in the Commission of Incorporation of New Health Technology, CONITEC. We don't have a seat in the CONITEC. We have to have a seat there to participate in these decisions. And also, I guess what we need in Brazil, we need that the government also take the model of Casa dos Raros as the best model to help us implement our model in the unique system of health, to have like Casa dos Raros as a model to treat and to diagnose the rare disease patients. And also, I'd like to invite all of you to participate in our event the next week on 19th of August. We are making an event in Sao Paulo and WTC, and we will have the participation also of Dick, and Diego will be presentially with us, and who want to participate can also participate online in our event called the scenario of rare disease in our country. We will discuss a multiple kind of important issues in our country, and how together we can develop a new design, a new model for the future, and what is the challenges that we have for the next 10 years. Thank you a lot.
Thank you. Okay, Dr. Giuliani, would you like to add anything?
Yeah, just a comment. I think that one thing, I don't know how it is in other countries, but in Brazil, there is a lack of coordination of the efforts. You have people developing actions at the cities, other at states, federal actions. There are different committees, and there is a lack of coordination of this effort. And this, I think, would improve a lot if you have something coordinating with representation of these different segments, like advocacy groups, like scientists, like health professionals, and the industry, and then have a coordination of these efforts, and very closely linked to the Minister of Health, that is the body that can provide some improvement on this area. So this is would be my thought. And thank you for inviting to participate in this event.
Okay, so thank you again to all of our panelists and to everyone that joined us here today for this conversation. I think there are many takeaways from all of your insights, but one that resonates for me across the board is the importance of stakeholder engagement for any health transformation, including and especially in rare diseases. The efforts from all the actors involved must be coordinated between, the industry, medical societies, governments, patient organizations, and the roles of both the public and private sectors have their own importance, and we can explore how public-private partnerships may be a solution, may help us reach solutions that can benefit everyone. So thank you again, and I'm going to turn it over to Dick to close us out.
Thank you, Mariana. And once again, thank you to our distinguished guests. Your presentations were thorough, thoughtful, informative, and raise a lot of interesting questions and encouragements. I would like to specifically just make a couple of observations from your presentations. One, both Dr. Gonzalez and Dr. Giuliani, with your respective country, the directions, some of the initiatives you're already taking, serving as a model for others within the region. I think this is very important. I think something Mariana also addressed that you all did was the greater society awareness of the challenges that come from rare diseases, not only to the children, but the families, caregivers, and just the burden of disease in general. I would also agree with the need for definition, standardization for rare. I think Claudia addressed that with some of the difficulties. And, that also has an impact on providing the incentives to the industries. But I also would comment about one of the needs that you all brought up is dealing with a newborn screening. And there's a lack of both definition, not so much definition, but importance that different countries have given it. Most countries have recognized the need for it, but have not implemented programs. And so I think that's a critical area. And then generally, you were talking about really needing to deal with the multiple challenges collectively: cost, diagnosis, treatment, patient, family burden, and access. And I think you all dealt on those very clearly, very concisely, and it was, I think, a very effective presentation. I want to thank you all. I want to once again thank the Wilson Center and Mexico Group Institute for helping put this on. And last but not least, another shout out to our sponsor, Horizon. So thank you very much. And Tony, look forward to being with you next week and continuing this journey.
Of course. Thank you.
Thank you, everyone. Goodbye.
Bye.
Thank you.